The number of hospitals now excluded from load shedding have more than doubled since September, when action was launched to insulate them from the crippling effects of load shedding. 72 institutions across the country now have priority status. Let's find out more with Health Department spokesperson Foster Mohale. Good evening to you and welcome to Full View. Some of the hospitals are supplied by Eskom, others directly by the municipalities. Do these exempted hospitals pertain to the Eskom-supplied ones exclusively?
Good evening, Iman, and good evening to SABC viewers, and thanks for this opportunity. Yes, the number of hospitals that we've provided includes both the ones that are supplied by municipalities in various provinces and also in Eskom. So it's a combination of hospitals provided by different entities.
All right, so the fact remains now that new infrastructure needs to be built to enable more hospitals to be more power independent. What can you tell us about that process?
Yes, as we have announced during the course of the week, that for about 28 of hospitals remaining from that list, for them to be excluded or exempted from load shedding, we will need to build a new infrastructure in order to make it easy for Eskom technicians to exclude them. And that exercise will cost about 100 million rand. So this is something that the Eskom and the Health Department will be meeting with National Treasury in order to see how can the government assist, because this is a once-off project which is going to assist the Health Department for a long time.
It's a once-off project which is urgent, as you say, but it is also expensive, given the fact, of course, that you have to include Treasury and others to ensure that it is expedited and made possible. Just in the context of, all of the other problems we've seen with expedited projects, what governance is going to be brought to bear to ensure that, A, the money is procured properly and disbursed properly and accountably?
Definitely, as you correctly said, that this is a very costly project which is not budgeted for. But while we are still trying to explore different avenues on how to fund this project, we are going to continue to assist those hospitals which are not going to be immediately isolated with the resources such as your fuel, so that we ensure that their health, the provision of essential health services is not compromised. So no life is going to be lost as a result of a power outage.
But just tell us a little bit more about the governance.
So yeah, this is we've got a steering committee at national level, which is led by the Director General of Department of Health, Dr. Sandile Utelezi, together with his counterpart from Eskom, who's the group executive for distribution, where other provinces are represented by the heads of departments in order to find out on how we can better coordinate this. So as soon as they find they are done with costing of this exercise, we are going to present a proposal to National Treasury to see how can they intervene in order to ensure that this is implemented. As I said, that this is a once-off project, costly as we admit, but it's going to assist the Department of Health going forward.
Yeah, you don't want to rush, but it is urgent. So you've got to put all these this architecture of accountability in place. What timeframes are we looking at to get this done?
Yeah, as I said, that there are technical challenges, which includes the way the current electricity network is configured. So we are going to ensure that we've got different time frames from short to medium to long term. So other hospitals will not be immediately isolated, but others will be isolated in the near future. But as we say that for this one of 100 million or for about 28 hospitals, this one is a long-term project. But as I earlier confirmed that we will ensure that while we are still trying to find the resources to fund this project, to ensure that these 28 hospitals, they get easily exempted or excluded from load shedding, we'll continue to assist them with resources to ensure that other sources of power supply, they are available to ensure that the service provision is not affected at all.
What can you tell us, Foster, about the initial program in which, those 36 hospitals or so were excluded from being cut off from power? Has there been any feedback on how that process has benefited them or that exclusion has benefited them?
Yes, yeah. As we said, that this is a phased-in project, it's a work in progress. Yes, the feedback that we have received from the first batch of hospitals, which is about 37 hospitals from the province across the country, is that now the provision of services now is going smoothly, unlike before, where other provinces like Limpopo, remember that they even had to reduce the elective surgery. So now all the work is going accordingly. So no service provision has been compromised in those the first batch of hospitals. But we believe that even the next, the ones that we've just announced, we believe that the provision of services will continue as planned.
What about subsidies for, or support, I should say, financial support for those hospitals that have been augmenting their electricity supply in times of power cuts with generators and having to use diesel and all of those extra provisions? What support has been given for them?
Yeah, just to be frank with you, most of the provinces or hospitals, they depleted their funds meant for this fuel for and oil and maintenance of these generators in the past few weeks, months. So already they are working on an additional resources that have been provided by national and the provincial departments of health in order to ensure that no health provision is compromised. So already most of them, they depleted their resources for fueling. So, but in order to ensure that the health provision is not compromised, as national, we've coordinated efforts to ensure that they get supported with additional financial resources to maintain this power supplies, generators, and other uninterrupted power supply systems.
All right, and how many hospitals are benefiting from that?
So far, the hospitals that are benefiting we've got about almost 400 hospitals across the country, but we only submitted the first 212 priority hospitals, which was decided by the provinces. So national did not decide on any hospital to be prioritized for exemption from load shedding, but only the province that provided that. But while they've done that, but we're going to ensure that all those who are not yet excluded or exempted from load shedding, they continue to get support from both the national and the provinces with resources and the financial to ensure that they don't get any experience, they don't experience any challenges with regards to power supply.
I must loop back to the accountability and oversight issue because we've seen, how these ad hoc provisions or these expedited line items, such as the provision of fuel or backup energy sources for hospitals in distress, have been opportunities in the past for people who want to benefit unduly and wrongfully, even criminally. So just give us and the nation an assurance that it is being managed well, that the extra money that's been laid on or requisitioned to support these hospitals and make sure the power stays on is being closely managed and every cent can be accounted for.
Yeah, all the decisions to shift the funds from one item to another is first communicated with the national and provincial treasuries to ensure that during the time of auditing, at least they will be aware of what transpired in order to ensure that all the monies that have been transferred to the provinces, to departments of health, are accounted for.
Foster Mahale speaks for the Health Department. Thank you very much for the update tonight. We appreciate it.